Okay, so for some reason we're having a little problems with our PowerPoint today. First I wanted to tell you a little story about my mom. One of the reasons brain health is near and dear to my heart. Rick's dad had dementia. Rick just stepped out. My mom has Alzheimer's. At this point she still kind of recognizes us, but she would forget to eat if she did not have help. And so I have a real concern about myself getting Alzheimer's. So I want my brain to stay as healthy as it can. And so I have an excellent panel for you today. I'm really excited. I had never heard of the Neurology Center, and Andrew has joined us today. It's up at Carlsbad. I'll let him fill you in on who he is. I'm also going to have Lena come up with the Alzheimer's Association. So I'm thrilled to have both of you. Please come on up. Let's give them a hand for being here today. Rick, if you'll help me with the clicker and it keeps moving on me. Yeah, we'll let you know when we want to have that moved. So what I'm going to do is, first of all, have Lena and Andrew introduce themselves and tell you a little bit about who they are, who they're with. And so let's start with Lena. Let's go ahead and have you share.
Hello. Okay, there we go. Good morning, everybody. It's great to see so many of you. I was here, maybe 2 or so years ago, so if I look familiar, that might be why. But I just want to thank Christy and Rick for inviting us back and for us to share a little bit about what we do and who we are. So my name is Lena. I'm one of the community engagement managers with the Alzheimer's Association. We San Diego and Imperial County, so we serve all of San Diego County and all of Imperial County as well. So I do things like this. Education, outreach, awareness about the disease to families, those maybe who just recently had a diagnosis, or maybe a loved one has a diagnosis, or even folks who want to learn more about the disease itself. I'm always learning something new every day with this role, and so it's been really great to be able to do that with folks and families who kind of have the same mindset as well. I do have a personal connection as well. Many years ago now, my great aunt was diagnosed with the disease. We all lived with her, and so being with her at the time, I didn't really know what was happening. I think I was about 9 or 10 at the time. And so, my little role was, make sure she goes to the bathroom, or let's get lunch, or, make sure she doesn't leave the house, right? And so looking back, it was really kind of like a little caregiver to her, right? So, so being here now, it's kind of full circle for me to be that resource for people who may need services right in the community, because we certainly did not know how to do that, did not know how to find it. And it was really up to my parents to be her primary caregiver. So it's been really wonderful to be kind of that bridge to folks and families who are needing support, and being able to guide them in the right direction. So I'm excited for today's talk and the panel, and brain health is very important and near and dear to me as well.
There's no CD.
Could one of you stand by the door or keep an eye on this place?
Good morning. Good morning, everyone. My name's Andrew Inocelda, and I am the Director of Quality and also the Director of our Memory Care Clinic at the Neurology Center. Thank you, Christy and Rick, for inviting me, and it's lovely to be here with you as well, Lena. I'm here because I have experience as a part-time caregiver for a family member of mine who has dementia. I have experience with changing diapers, with showering, brushing teeth, shaving, and so I often say to patients that I take care of, where I have the experience of sitting in this seat taking care of you, but I also have the experience of sitting where you're sitting. And so I have a keen understanding of the emotions that are going on, and that's really important, I think, in my role as the director, to be able to have that experience. And that's part of what has inspired me to help to take care of a community. While I take care of individual patients, it's so important for us to see how taking care of an individual patient ends up taking care of a community just like this. I think that if a community individually and collectively feels well, then it's a healthy community. And a lot of what I take care of is sort of at the later stages of what I'll see in regards to brain health, where I'm diagnosing conditions, I'm prescribing medications, and prescribing therapies. So it's nice to be here where we're talking about brain health and what we can do now in preparation for or to try to avoid neurological conditions. And I hope not to see anyone in the clinic in the future. But it's just nice to be here and to talk about how we can do more preventative measures rather than just talking about here's the new treatments that are available. So thank you for having me.
Thank you. This is about brain health, but I've asked Lena to start us off with what the 10 warning signals are for Alzheimer's and types of dementia. So we're gonna turn it over to Lena, and Rick, will you turn it to the next slide?
We've gone dark, but that's okay. It's all good. So I'll just talk a little bit about it, right? So some of the questions, maybe one of the biggest questions that we get, in programs or when I'm out and about in the community too is, folks are asking or they're maybe worried about, their loved one or maybe even themselves sometimes, right? So just gonna take really quickly to talk a little bit about what those warning signs look like. And I have my own little cheat sheet, right? So I actually have these here in the back, along with a little bookmark that kind of has all of the signs listed as well. So I have plenty of those if you want to take a look, just again, for your own knowledge as well. So the first one is memory loss that disrupts daily life, right? And then another question I get is, what is the difference? Like, is this something I should be concerned about, or is it, normal, quote unquote, right? So I think it's going to come up soon and it'll kind of follow along with what I'm saying. Oh, there we go. Perfect. So memory loss that disrupts daily life, right? And then a typical age-related change, sometimes forgetting names and appointments. I am very guilty of this as well, but remembering them later. Okay. All right. So number 2, challenges in planning or problem solving, right? So kind of that day-to-day, making sure that we can, get through some of our typical day-to-day challenges, right? But then making occasional errors when managing finances or bills or things like that, that's perfectly normal. All right. Number 3, difficulty completing familiar tasks, right? One of the stories I like to share with this one is that, one of our volunteers actually, this was a warning sign for her mom when, so she traveled a lot, mom dropped her off at the airport and picked her up, weekly pretty much, right? But then one day, she's at the airport and she's waiting and she calls her mom. She's like, mom picks up and, mom says, oh, I don't know where I am. I'm not sure, why I'm not at the airport right now. That was a warning sign for her, right? There was something she was doing all the time, and then suddenly she wasn't able to make it to the airport anymore. So that was a warning sign for her family. Confusion with time or place. We see this a lot as well with some families or with folks who have the disease. But getting confused about the day, the amount of times I say, what day is it today? Or is it Tuesday? Right, but then I remember that, right? I remember it is Tuesday, but then, not remembering or not being able to recall that could be a warning sign for people. 5, that's the last one I think on the slide, is trouble understanding visual images and spatial relationships. So like kind of depth perception can change a little bit. Not to be confused, of course, with any vision changes related to cataracts or eyes actually changing, right? And then if we go to the next one, oh, perfect. 6 is new problems with words in speaking or writing. Sometimes it shows up with folks not being able to recall words. And, typical age-related change, right? Sometimes having trouble finding the right word and then, recalling it. Again, I'll use myself as an example today a lot, but sometimes I forget what I'm trying to say or what word I'm trying to use, right? But then I'm able to get back, jump back and remember that, but not being able to recall that could be a warning sign as well. All right, 7, misplacing things and losing the ability to retrace steps. This is another one. Again, the amount of times I say, where's my phone? Where's my keys, right? But then I can remember, like, oh, I was in, the living room last. Let me go check there. Or I was in the kitchen. Let me go check there as well. But folks who have the disease or showing signs of the disease usually can't remember. They can't remember that they went through the garage to get home, or that they left their keys on the couch rather than the waiting table, right? So it's not being able to remember where we might have been before that we replaced our things, right? Decreased or poor judgment is the next one, right? So we see this a lot with dealing with money or finances. But making a bad decision once in a while, like changing the oil in the car, guilty, right? That's totally normal, and age-related change as well. 9, withdrawal from work or social activities. So I kind of liken this to someone in your family who always loves social gatherings, right? They love being with people, they love seeing other folks, but they're becoming more and more kind of withdrawn, right? It's not normal for them. Again, for me, sometimes I like, a nice Friday at home with no one around me, right? But it's, if that's those behavior changes or that, I guess, rapid change in, not wanting that anymore can be a sign. And then finally, maybe the biggest one we see and hear from families is changes in mood and personality, right? So mood swings, acting out, we hear that a lot. And here, typical age-related change, right? Being very specific, they're liking a specific way of doing things, and being a little irritated when things are changed or disrupted. Again, guilty, right? I like my ways, I like my routines, and but those major mood swings or behavior changes can be a big sign. And I know that was a lot, right? It's a lot. The 10 warning signs, right? We have a whole other program about it, but I always say, folks will ask, well, I have 10 of these things, or I have 3, maybe 4, right? But the biggest thing I say is when it becomes an issue of you or your loved one, right? Or anyone who you're worried about living their lives, their normal routines, and when it becomes something that hinders that, or that becomes a struggle that way, that's when we usually say maybe it's time to talk to someone about it. I know Andrew said he didn't want to see you at the clinic, but maybe it's time to talk to someone, a professional, about that, right? So it's not like all or nothing, but when it becomes something that keeps you, again, whoever you're worried about, right, from living their normal happy lives, right? Then it becomes something that maybe let's have a conversation about this.
Thank you, Lena. And you do have those over at your table afterwards, so if people want to pick that up, they can. Also, I didn't mention the handout. If you haven't opened the inside of it, on the left side are some of the key issues that we're going to be talking about. And there's room on the right side to take notes. If you have questions as we're going through, please jot the questions down. We'll save time at the end to go through those questions and be able to answer them. We'll just ask for you to just have one question so everyone has a chance if they have it. So we're going to start off on having more of a panel discussion now. And so Andrew, what happens in the brain when we don't get enough sleep, and how does that impact our memory and cognition?
That's a great question. What I want to do first before I get to that question is kind of piggyback on what Lena was saying regarding activities of daily living and the signs and symptoms that you'll see in dementia. I think that the word dementia has a stigma attached to it, and I see it often. I cannot tell you how many times I'll say the word, and what will end up happening is one of the individuals in the exam room will start leaning back like this and start going like this. Or there's a facial expression that I'll see of disgust or distrust. I think that it's important through Alzheimer's Association and through meetings like this where we start to get over that stigma, because ultimately what I'll say in the end is if I don't tell you what I think is going on, then I'm not actually taking care of you. So we try to avoid that stigma surrounding that. But it's really important to understand the definition as well, because there's a difference, as Lena was saying, between normal aging and abnormal aging. So just quickly here, how we define in neurology and neuropsychology, the definition of dementia is when you have memory complaints. You yourself are saying, I am forgetting things a lot more often. And then when we do our memory testing, which you might hear as MMSE or Montreal Cognitive Assessments, those tests also show that it's an abnormal score. And we do further tests through neuropsychological evaluation, which is a longer battery of tests that can last for 3 to 4 hours. But then we have a decline in activities of daily living. And when we have all three of those, we've got the subjective memory complaints, we've got objective memory issues, and then we have its effect on your everyday living, that's when it's termed dementia. And there's many different types of dementia. Alzheimer's is the most common that we'll talk about because it causes 50 to 70% of all dementias in the United States. Other statistics is 60 to 80% across the world. You have frontotemporal dementia, you have Lewy body dementia, you have Parkinson's dementia, you have vascular dementia. So there are many different types, and dementia is just the umbrella term for these different types. And it's important that we try to find out which one it is, because it matters which one it is because of the medications that are available and then the treatments, things that you don't want to prescribe, things that you do want to prescribe. So that's really important in understanding of how we take a look at the picture of these memory complaints. And no, not everyone that forgets someone's name that they've seen for the past 3 meetings like this has dementia. And I know that that's scary. But we can think about it as, we've all developed these large libraries of memories and facts and events over the years that end up getting stored, and maybe it takes us a lot longer to get from section A to section Z. And that might take us a while, but when we're able to recall it over time through a prompt or through remembering letters, I do a trick where if I can't remember someone's name, I actually go through the alphabet. I'll start off at A, B, C, and then by the time I get to T, they're looking at me like, why are you just staring at me? And I said, I had to get all the way to T to remember your name, Thelma. So there's certain tricks that we can sort of see how our brain reroutes around these things. Most common cause of forgetfulness in the United States is depression and sleep deprivation. So we can't skip over that. We really have to screen for that first and foremost. And then I'll get to the question about sleep. Sorry, went off a different path.
No, I appreciate that you did that. It's very important. Thank you.
So with sleep, there's 2 stages of sleep that I want to focus on. So the first stage of sleep that occurs in the first half of sleep is slow wave sleep. And what happens in slow wave sleep is our hippocampus is very active. And what that's doing is consolidating memories. In particular, it's consolidating facts and events. If we don't, patients with insomnia, for example, they can't initiate sleep. Their slow wave sleep cycle is shortened. And so they might wake up in the next morning going, I don't remember what we did yesterday morning, or what did we talk about during brunch. So sleep is really important in taking those memories that have been learned or things learned through the day and then solidifying them into longer term memories. At the latter stage of sleep, you have rapid eye movement sleep, and many of us know that if you're looking at someone that's sleeping next to you and their eyes are fluttering like this, that's when we consolidate more of emotional memories and procedural memories. So in that stage of sleep, if we lack that, and one of the causes of lacking that type of sleep is obstructive sleep apnea, for example, where what happens is your brain is not able to stay in REM stage sleep or not even get there because there's not enough oxygen to your brain. So what ends up happening is your brain says, I need you to move and wake up because I need more oxygen. And so you shift and you move slightly, and it takes you out of these stages of sleep, and you kind of start back from the beginning again or move a stage back. So that's something that we also screen for, is that if there's other things that could cause sleep disruption, because if you're noticing cognitive difficulties, we have to make sure we're looking for all the other things before we're saying, well, we're worried about a dementia. So sleep is really important in our recovery. We also think that that's where we end up clearing out chemicals and proteins in the brain that we think contribute to dementias. And I think we'll talk about those a little bit later.
So I have a question for you as far as sleep goes. So say you didn't get a good night's sleep and you take a nap, does that count for the extra sleep, or or do you really need that one good night's sleep?
Typically in adults, we need about 7 to 9 hours of sleep at night. And the longer the duration of sleep, the more likelihood that you get to REM stage sleep, which we believe is to be the most recuperative stage of sleep. So then if you're taking a nap on the recliner for about 30 minutes, perhaps you don't get to that stage of sleep. What napping also does is it disrupts what's going to be happening at nighttime. It could push back when you're going to be doing sleep initiation. It'll end up affecting the duration of sleep that you'll need. So napping during the day, while you certainly earned it, right? We've been working really hard and we've earned the nap in the afternoon. I think I took one yesterday. But it can disrupt the nighttime sleep that you have.
Thank you for sharing that, because I often wondered about it, so thank you. We all know we should eat well, but what do nutrients and eating patterns have a real impact on the brain, and why?
So a lot of what I based this panel about was based off a recent study that was published by Dr. Dean Ornish and his colleagues. One of which is Dr. Glasgow, who's at UCSD and is a researcher and physician neurologist there. And what they focused on was this was just a 20-week randomized control study. So they had about 26 patients in the treatment side and then 25 patients that were not receiving any treatment. And what they really focused on was diet, supplementation, exercise, and stress management. And on the diet side, what they focused on was, I believe it might be up there, they focused on a whole foods diet. So, most of us know this as the Mediterranean diet. More vegetables and fruits, less meats, right? More fish, good healthy fats. And what they ended up doing with this study just over that 20 weeks is they ended up mailing these meals out to the patients. And even the snacks, so they couldn't find their own snacks. And so these foods were found to help decrease cognitive decline in patients that were in the treatment group versus the non-treatment group. And what they also found, which was really surprising actually, was that they did testing for what's called Alzheimer's serum biomarkers. So they look for these abnormal elevated proteins that they can see in the blood, which we can infer what's going on with brain health. And they also saw those amyloid markers decrease during post-study. So just in 20 weeks of altering the diet, the title of the study is Extensive Lifestyle Changes and Dietary Changes. So it was quite extensive to only eat these very specific meals over that 20 weeks, but it made both a biological change, but also a change in cognitive function. So the diets that we see, I listed some books that I think is in your handout there, just to keep it simple, because there are so many diets and books out there. It's really difficult. Should I follow this one? I did this one for 3 months. I did this one for 6 months. Which one's better? For the most part, it's getting started and sticking to it as best as you can. I think the best advice was for those foods that are high in refined sugars, high in bad fats. The idea is not necessarily that you can't have them. It's just don't have them in your house. So that if you have to have that ice cream from Handel's, you can go out and buy it. And then look at that, you're exercising by getting out of the house. You're perhaps socializing at least with the person taking your order. And then you're able to get that reward rather than having the bucket of Dreyer's ice cream at home, for example. So I found that that's a much more palatable way to understand about diet, rather than this is a very strict diet that they have to stick to. Instead of trying to do a wholesale change, you just say to yourself, well, I'm just not going to bring Snickers candy bars into the house from Costco. I'll just go out and buy it when I want one. So that was a nice piece of advice that I heard from another presentation.
So I have a question on, can you hear me? Yeah. So I like French fries. And so when I eat them, what's it doing to my brain so that I won't want to have them?
Great question.
So that's interesting. It kind of leads me to where we're going to follow with this question in the end on where where we're hopeful for things, but most of us here have heard about the GLP-1 agonists, Ozempic, Wegovy, semaglutide. And what's been interesting about these medications is their impulse control that they end up causing, which no one really knew that that's what was going to happen. I have patients that were illicit drug users, were smokers, were alcoholics. One of my patients who I take care of dearly, he said, Andrew, something's wrong with me. And I said, what's happened? And he said, I haven't been to jail this year. And I said, I don't think that's something wrong. I think that's a good thing. And he says, yeah, I'm so boring now. Ever since I started Ozempic for my diabetes, I don't want to go to the bar. I don't want to do any drugs. I don't want to smoke anymore. I don't want to hang out with my seedy friends at the bar. And I haven't gotten into any fights, and so I haven't been to jail in the past year. That's really strange for me. So it's really interesting how it has provided this impulse control. So when we talk about French fries, what French fries does is, I don't know if you know this, but they're almost chemically engineered to deliver a burst of fat and salt right at the very beginning. That's really important for that, because then you develop this loop because you have this craving for it. And that's what you immediately want to have, is the fat and salt right in the very beginning. And that's what creates this habit loop where it's like, I have a craving, I get the reward, I have a craving, I get the reward right away. So it's really hard to break through that habit and craving. So where these new medications are somehow improving our impulse control, because marketing and everything else has done such a good job of making us stay in this loop where if we're thinking about French fries, it's almost that Pavlovian thing where you start to salivate a little bit. But it's a very strong reaction by the brain, and it involves this frontal lobe activity that is difficult to break. So we're seeing some medications that are changing that unexpectedly.
So you may know the answer to this, but as you're talking, I was thinking of the GLP-1. So are there things besides taking that drugs that create that? Like, is there a food or a supplement? Or is that a question for someone else at another time?
We don't know of one yet, and I'm sure there's scientists that are much smarter than us that are working on that right now.
Okay, thank you. Sorry for throwing that question in there. So exercise is often tied to heart health, but what role does that physical movement play in supporting our brain function and preventing decline?
So when I took a look at this question, I wanted to focus on what we touched on earlier, which was sleep. And so what physical exercise, really moderate to intensity of exercise, where for 30 minutes you're getting that heart rate up, around 110 heart rates per minute, and basically breaking a sweat. What that's shown is that it improves the initiation and stability of slow wave sleep, so that's important. And then it also improves the quality of REM stage sleep. So when we exercise, it's positive effects on our sleep, where we feel that it's in our sleep that we're recovering as well. We're clearing out chemicals that end up causing neuroinflammation and oxidative stress in the brain during our sleep. So if we get optimal sleep, then those things can improve. So that's one of the biggest things that exercise does. And then when we talk about the cardiovascular effects, for example, if we decrease the amount of atherosclerotic plaques that get developed within our arteries, that improves the blood flow to the brain, and then we help keep the cells more viable for a longer period of time. So those are the two areas that physical exercise helps.
Christy, if I could add to the exercise.
Who's talking to me?
Yeah, I know, this ominous voice. I was just gonna say, if I could add to that exercise piece, like that is a great example, right, of doing like low impact, but you're getting your body moving, right? Whenever we talk, or whenever I give, talks about, exercising more and doing more and getting that physical activity in, right? You certainly don't need to go out and sign up for a marathon or anything like that, right? It's not, anything crazy like that. I'm not a runner, so I would never do that. But, it's things like taking a walk around your neighborhood, right? If you got a furry friend, it's perfect time to take them for their walk, right? Or, here at the senior center, if there are classes that you can take. I have recently, it's been about a year now, but I joined the Y, and I've been loving doing dance classes. And that's what I love to do. And so that's what I do, right? And I'm not, doing things that I don't want to or don't like, right? But it's finding that thing that you like and sticking to it, right? Again, if it's a stretching class or a yoga class, or if you like to dance too, let's go, right? So it doesn't have to be anything too crazy, but even getting your heart moving, like Andrew was saying, getting that blood pumping through your body to your brain, that's really that's all you need, right?
Yeah, it's and there's a lot of online TV type of programs that you can turn on to do stretches. How many of you felt a little bit more energetic after doing that? Yeah. Maybe not everyone, but I definitely felt a difference. Okay, so back to our questions. Many people underestimate the power of connection. How does isolation affect our brain over time, and how can relationships act as a protective factor?
So from a neurological perspective, how we take a look at it is studies have shown that in patients that have had social isolation, that they'll have a decrease in gray matter volumes and in very key components of the brain that are needed for memory function and cognition. So the gray matter are the brain cells themselves. Those are the cell bodies. It tells your body what to do. It also interprets the information that's coming into the brain from the rest of the body. And in the areas where they see these loss of gray matter volumes are with the hippocampus, which is the area that helps consolidate memories. And then in the frontal lobe, which helps with behavior and mood and executive decision making. And then it also affects gray matter volumes within the temporal lobes as we're storing memories. So that's what we've noticed in social isolation. In addition to that, with the COVID-19 pandemic, we saw an increase in the rates of dementias. As a result, there's many other factors that lead to it, but we think that social isolation during that period of time was certainly a factor in that too.
Yeah, and I think it's so important to have that connection, right? I think, especially during COVID, I was going to mention too, when we literally couldn't do that, so many people kind of fall into, just being them by themselves and, not being able to see other people. And that can really affect, of course, neurologically, right? But even like our mental health and, our happiness, really. I think, not being able to do so really, at least for me, it was a very hard time, I'm sure for all of us too, but not being able to do the things I like to do out, in the world, right, or see other people. It can really take a toll on our mental health as well. But the good news is you all are here, so you're already doing that, right? So check one for the day for our, connection, and making sure you're getting that, face to face with people, because it really is so important.
So let's talk about stress now. What does chronic stress do to the brain structure or the chemistry?
So what we think chronic stress does to the brain is it causes an abnormal release of cortisol or glucocorticoids. And cortisol levels that are high within the brain, over time it causes neuroinflammation. There's an overactivation of these cells that help to clean up the brain and our immune cells called microglia. And when they're constantly stimulated to be working, while they're trying to clear things out, they end up causing more inflammation and more oxidative stress, and therefore cause more damage to the cells and the neurons within the brain. So the chronic stress and that constant inflammation over time, it sometimes is difficult to dial that back as well. So you might find yourself trying to do box breathing exercises, and maybe you only do that for a week, but it's not always long enough. During that clinical trial that I was mentioning earlier with Dr. Ornish and his colleagues, what they did as part of their design was they had mindfulness, yoga, and meditation 3 times a week for an hour, along with stretching routines, just like how we did here. And that was a strict routine that they had at least 3 days out of the week, including physical activity with weight training, about 3 days out of the week for an hour, and walking for 30 minutes every single day. And they were able to show some actual changes within the brain chemicals. So those are important things to remember when we're talking about how that affects the brain.
Lena, do you have anything to add? Like, if you're starting to have dementia or Alzheimer's, is trying to reduce that stress gonna help?
No, definitely, I think with what Andrew was saying too, right, you know, the more stress we can put on ourselves, right, in our brain, like that can really, you know, kind of exacerbate some of the signs, right, that we're talking about with stress, you know, not being able to sleep or not being able to recall, you know, things, and can really even kind of speed it up maybe sometimes too with, you know, the way that we recall or think about things. So absolutely, I think, you know, finding, again, kind of similar to the exercise, right? Finding something that helps you stress relief, you know, is that meditation, is that yoga? I'm a big reader, so I will read light and happy things to reduce some of my stress, right? So it's, again, finding something that works for you. I have a friend who bakes, so she bakes things. We reap those benefits when she's stress baking, but you know, that helps her, right? So, you know, making sure that you have that outlet, whatever it is, that works for you, to make sure that we're kind of managing that.
Yeah, so I've noticed it helps me to go out in the garden. You know, it's kind of almost a form of meditation for me to be out there, or something. You might go for a walk on the beach or something like that. The hard part is sometimes we don't even realize how much stress, you know, that we're just like doing it. And I'm fortunate enough with my husband, he'll point out, it's like that, you know, I'm adding more stress or I'm getting stressed out. And so kind of encouraging people that you love, and you're seeing that, to point that out. Do you have something more to add?
And I think it's important too to recognize that doing things that relieve stress isn't a weakness. And sometimes I often tell patients that we're not going to wait till your stressor goes away, because whatever it is, they've got a family stressor, there's a wedding coming up, they're have a new baby in the family. Because I'll say that living is stressful, so let's not wait till all the stress goes away, because we might not like the results if we wait. So it's important to, again, it has a stigma behind it, the meditation, the mindfulness, all of those things. When I deal with veterans, for example, that might look at me and say, and any veterans here, thank you for your service. I see a few hats up here, thank you. My brother's retired Army, so I certainly appreciate all of our veterans. So with what ends up happening when you need some of this mindfulness and you get this stigma around it, and everyone's doing alms and, you know, sitting in the middle of the floor with goats running around them during they're doing yoga and things like that. I don't think that we should be ashamed about needing these moments, because with some of the veterans, I'll tell them, they'll say, oh, that's, you know, they might push that back, and I'll say, well, what do you think you and your colleagues are doing to combat the stress that you're dealing with? And this is something that I've seen with my brother, for example, is they're drinking alcohol. And I'll say, what does the alcohol do? Well, it helps calm me down. And so, well, what else is it doing to your liver and everything else and your brain health? All I'm asking you to do is just take deep breaths for like 2 minutes. That's it. And sometimes that's how we get some buy-in, and they start to recognize, oh yes, this is how we've been relieving our stress, is through substances. And part of this brain health is to talk about how we don't need substances in order to improve our health.
So the breath is really important. As a realtor, I often find some of my clients getting stressed out, and so I remind them to breathe, but I also remind them to be kind to each other, because a lot of times as we get stressed, we take it out on those we love. And so, you know, again, it's like, if you're finding yourself doing that, to take some deep breaths, because that is important. Let's talk about mental stimulation, which is often recommended. How does learning new skills, challenging your mind, keep your brain resilient, even later in life?
Another check mark for you all. You're here and you're learning. There you go, right? So learning new things. We always, say if there's a hobby. I know a lot of people say learning a new language, right? Or, learning a language, period. Or, even learning a new hobby or a new skill. I think, Karen, did you mention the bracelet making, right? So learning something new that's here right at the senior center, right? That really helps, getting getting those cells, and I'm sure Andrew will have a more technical explanation about like, making those connections and building on those connections in your brain, right? When you learn something new, it challenges your brain, and it keeps, I always say, keeps everything moving, right? And so, being able to, be here with us today, or, taking a class online, or even watching a documentary, and learning something new. I've heard, what is it called? The Ken Burns documentaries, or okay, I hear some murmurs. Yeah, I've heard those are really great, or any of the things that are educational to even watch. I know I learn best by watching sometimes as well. So being able to learn something new, or find a topic that you want to learn more about, it always helps with again keeping it moving, and making sure we're building those connections in our brains, and making sure we're keeping it stimulated, because I think one of the things that happens as we get older too is slowing down and maybe not taking steps to do more or learn more or be more active, right? But the more that you do it, the more again active in other ways as well, and that keeps us all healthy too.
And one of the things, as you were talking about like documentaries, I was impressed yesterday. Rick figured out how to have YouTube on our TV. And so he had an educational based thing instead of news or something else on the TV that he was watching. So it's really great with technology when we figure it out. I mean, it took us a long time to figure it out. But it's like, instead of just watching some TV series, to put on something like that is stimulating your brain a little bit more. Okay, your turn, Andrew.
So the technical term we'll use is cognitive reserve. And the way that I try to explain that is, maybe this speaker here represents a place in our brain that we want to go, a memory or a procedure or something that we want to recall. And when we're learning new things, we're building more roads to that point within our brain. So if we don't learn new things, then we'll just have the one road to there. And so when it gets blocked because of a structural change within the brain or damage, then we can't get to that point. But when we learn new things and we socialize, we start to develop other roads that can get around any blockage. So that's why it's important to do all the activities that Lena was talking about, because that's what it ends up doing for us in our brains.
So when it comes to substance use, you had mentioned that. How do alcohol and drugs actually impact the brain long-term health?
So I guess I'll just focus on the vascular effects that can happen with alcohol and illicit drug use. Through the arteries and from the heart, that's how our brain gets oxygen. And if we're doing things that end up affecting the ability for the heart and our arteries to pump those nutrients and oxygen to the brain, then we'll have a decrease in overall brain structures. In chronic alcoholism, you'll also end up seeing a decrease in hippocampal volume. You'll see a decrease in cognitive reserve, for example. Alcohol also negatively affects sleep, and it affects your slow wave sleep and your REM stage sleep. So there's many factors on how alcohol will affect that, in addition to illicit drug use as well. It'll affect your stages of sleep and also your overall health and cardiovascular health.
So what does the hippocampus do?
So the hippocampus is an area of the brain and a structure that essentially takes ideas and things that we've learned through the day and solidifies them into more longer term memories. And that's the function that it serves.
So if we damage that, then we're not going to keep those memories? Is that how dementia comes about? Or?
So in specific types of dementias, and I think that as we've been talking about Alzheimer's dementia, for example, that's a particular structure within the brain that we'll look at on imaging studies. And typically what you'll see as Alzheimer's disease progresses is that area of the brain becomes smaller and smaller, or it atrophies over time. And so the hippocampus is also responsible for neurogenesis, so regenerating new cells as well to help us with memory. And if we lose that ability, then we have difficulties with obtaining new memories in addition to that.
Thank you. So some factors are out of our control. like genetics or past injuries, what can someone with a family history or past trauma do to support their brain health?
Yeah, that's a great question, Christine. And sometimes a lot of folks will come and ask, like, my loved one, my mom, my dad, aunt, grandma, has the disease, and I'm so worried about myself, right? But I will say, having a family connection, it does increase the risk, right? But it's not, you will develop the disease. It increases your risk. And so, but I will always say too, if you have a brain, you're at risk. Sadly. I hate saying that, but it's true. So I think some of the things people can do to, reduce their risk is, some of the things that we've been talking about, right? Getting good sleep and making sure you're cognizant of what we're putting into our bodies, right? Getting outside and moving, right? Again, I don't expect anyone in here to go run a marathon, unless running marathons is your thing, then go you. But getting outside and getting that physical activity and making sure we're managing our stress, right? And maybe not the drink every night, right? And just taking those measures to reduce our risk. There currently is no cure, right, for the disease. There are treatments available, and I think we're going to touch a little bit on that later. But just making sure we're taking care of our bodies, to take care of our brain. If you've ever been to one of our programs, you always say what's good for your heart is good for your brain, right? So taking those measures and making sure that we're taking care of ourselves, our heart, of course, will take care of our brain as well.
So when we think about hereditary risks for developing dementia, some of you might have heard about a specific gene called the apolipoprotein gene. This is something that gets tested within our clinic and within labs. And the basics of it is, talking with Lena here, just because you might have an abnormal allele doesn't necessarily mean that you're going to develop Alzheimer's, because there's other factors. There's many other genetics that end up affecting your risk factors, your risk for developing dementia, including your environmental risk factors, in addition to your lifestyle. So whereas genetics certainly sits here, we have these environmental and we have lifestyle things that we can actually make changes on. Air pollution is actually considered to be a modifiable risk factor for dementia. So you can move, for example. So there's things that we can do. And I think that's the positivity of what this meeting is about, is here's what we can do, not just the fear of, oh gosh, is this gonna be me? It's more that hopefulness that this is what we can do, and this is what we know now. So with these genetics, I feel that it's also important, and this is where I really feel that which gives me this view that I'm not only taking care of the patient that's in front of me. When we do these genetic tests, I usually have a son or a daughter that's there, and then I have to look at them, because then they're thinking, okay, you've just made this diagnosis, and there's this genetic abnormalities, what about me? And that's where I can turn to them, and I can also take care of them, because they've got young children at home, right? They're right in the middle of taking care of their parents and their children. And it's nice to be able to talk to them and talk about the hopeful things that are coming up, and essentially end up taking care of the entire family. So that's one of the honors that I have of taking care of patients.
So, trauma to the brain. So, we're hearing more about football players and getting concussions and how that impacts it. Why does sometimes, you damage it, but sometimes the brain can change it and gain things back? I don't understand.
I think we're learning more about neurogenesis and neuroplasticity. I think these are key words that you might be hearing out there. We don't know everything about it just yet. What happens in football players, or those that have traumatic brain injuries, for example, there's this damage that occurs at the junction between the brain cells themselves and their extension cords, or their axons. And that's where that damage occurs, where you're losing connection, and there's damage in neuroinflammation and oxidative stress between the cells and their electrical cords that goes down to the brainstem, goes down to the rest of the body. And because of that neuroinflammation and that stress, they end up, the brain cells end up dying off over time. That ends up releasing more chemicals that end up causing this kind of vicious cycle of neuroinflammation and oxidative stress. So that's what we're seeing chemically and structurally in the brain in those cases.
Thank you for sharing that. So finally, those living with the cognitive change or recovering from a brain injury, what's one hopeful message or insight that you can share about the brain's ability to adapt, to recover?
So in my clinic and dealing with patients, I will sometimes tell them the facts about what brain damage does. Now, you'll typically think about, well, I only have so many brain cells that I have in my life. And then as I lose them, as I sneeze, I lose brain cells. As I think about sneezing, I'm losing brain cells. Maybe that's just me, that's what I heard growing up. Don't sneeze, you'll lose brain cells. Like, oh my gosh. Too bad I had allergies. But what is encouraging is that we are seeing that there is neurogenesis. We talk about cognitive reserve. We're able to develop pathways around blockages, for example. There has been a lot of research in stem cells, for example, that we've been a part of. Unfortunately, they're not showing positive results, but I think we're on a path to trying to develop methods of how we can regenerate the brain cells. Through these studies, we are showing that there can be an improvement in cognitive function, and therefore we think there's improvement of the actual structures within the brain. So these are things that are encouraging over time. I always say to patients, like, here's the data that we know now, where I think that you're going to improve the most within the first 6 months of brain damage. And then from months 6 to 12, things start to plateau. And then after month 12, you're not gonna make any gains. And they usually look at me a bit despondent, but I'll say, but prove me wrong. And I have had patients come back and say, Andrew, remember when you said I wouldn't be able to talk? Well, I'm talking to you now. And so it is surprising what the brain can do. I had a patient who was in his mid-20s where I happened to pull up his MRI of his brain, and I watched him walking to the clinic, and I was just doing some prep before his visit. He was missing an entire left side of his brain. And I was thinking, okay, I have to really read about this case now because I don't know why he's missing the whole side of his brain. And I watched him walking to the clinic. So he comes in with his mom, he sits down, and I just said, move your right arm, which he shouldn't be able to do because he's missing that entire left side of his brain. And he's doing this. And I said, can you stand up? And he started to jog in place. And I said, I don't know how you're able to do this with what I'm looking at on your MRI. And there was this tiny thin strip that was left over. He had an astrocytoma, which is a brain tumor that needed to be excised when he was an infant. And so this tiny little strip of brain that was left over compensated as he grew up to allow for movement of the right side of his body. So that's, for me, that's made it hopeful that our brain can actually adapt and adjust, not just at a young age, but also as we age.
I'll just add something really quickly too with the families that reach out to us or that we work with. There are many people who have mild cognitive impairment, or they have a diagnosis of Alzheimer's or another kind of dementia, and they are living well. I would say they're thriving even. So I don't think, I know we talked a little bit about stigma and how people don't even want to talk about it or say the word. When I'm out and about, sometimes people will see my table and be like, ooh, not now, but I think there are so many folks who are living well with it and thriving that I don't think it needs to have a limitation on anyone's life, on what they can do, and I think what Andrew said is such an amazing case, right? His whole left side of his brain is missing, but look at him thriving, right? So I think humans are great, and they are everything under the sun, and we can do so many things. And I think, just having a diagnosis or, anything really, it doesn't limit us from what we can and will eventually do.
Thank you. So years ago, I've had a couple bad auto accidents and had concussions. And so my doctor was doing a follow-up and did, an MRI of my brain, and she said I was fine. And I noticed on it, it had mentioned plaque, and I said, so is that an issue? And she's like, no. But now I'm starting to understand that plaque and Alzheimer's, and then there's this other thing, tau proteins or something like that. Can you help me understand? It's like, as soon as you have plaque, does that mean I'm starting to have dementia? Or, you know, it's like, can you explain a little bit about those two?
I think that's an important question now as we start to develop a lot, pharmaceutical companies are developing much more direct-to-consumer marketing campaigns that talk about get checked early, which I agree with, but it can be confusing on what are we checking for in the first place. We'll hear a lot about beta amyloid proteins, and what they are is they're pieces of a larger protein that helps support the immune system within the brain, but also the regeneration and recuperation of the brain. And what ends up happening is we think that this larger protein, the APP protein, gets broken up when it's not supposed to, and you get this little piece of a protein called beta amyloid, and it's sticky. And what ends up happening is these are outside of the cells, and so they stick and clump together, and they can get in between these synapses, so where one neuron talks to another neuron, we think it gets stuck there and it clumps up, and those are the amyloid plaques. Now, thankfully for you, you can't see those on an MRI of the brain, so I don't think that what you were seeing on that MRI was an actual plaque, so that should be reassuring. And when we talk about tau proteins, because the thing about beta amyloid is that while all patients diagnosed with Alzheimer's disease have beta amyloid plaque buildup, not all patients that have beta amyloid plaque within the brain end up getting diagnosed or ever will have Alzheimer's disease. So it's really important to make that distinction between the two. So it can't just be beta amyloid accumulation and plaque accumulation that ends up is the only cause of Alzheimer's disease. So you talked about tau protein. Tau protein is within the cells, and it helps support the structure. It's like a scaffolding for the neurons itself. And sometimes what ends up happening is it breaks apart, it gets misfolded, and that becomes really sticky, and they all come together within the cell, and it affects the function of the cell, and the cell ends up dying. So to be basically what we think happens is you get the beta amyloid plaque buildup first, and then you see the tau protein buildup next, and then the cell death occurs. And that's actually what we're doing blood tests, for example. We can actually see what are the beta amyloid levels, what are the tau protein levels, and we can infer what's going on with the brain. That's a fairly new test that we didn't have before. There's an amyloid PET scan of the head, which is not an MRI, it's a PET scan, it's a CT scan of the head, where a specialized dye is injected into the vein, and this dye ends up going to the beta amyloid plaques within the brain and binds to it, so we can actually see it light up on imaging. We take a look at the location of where those beta amyloid plaques are, in addition to the amount and size of it that we see, and it gives us a number called a total centiloid score. And if it's more than 30, it's abnormal. If it's less than 30, it's normal. So, and then we also have cerebral spinal fluid tests that we can do to look for amyloid protein elevation, and then also tau protein elevation. So these are studies that we can do. I think one of our worries in neurology is that everyone's going to go out and get these blood tests to see if they're elevated. And this is a concern because there has to be clinical information. You could be a rocket scientist with no cognitive difficulties, and everyone's saying that you have no job performance issues, but then you'll go and get this test done, you'll see that it's elevated, and you think, oh my gosh, I've got dementia. And I'm like, wait, no. There has to be clinical symptoms that we have to see before we make a diagnosis of dementia. And it does not always correlate with an increased risk of developing dementia just because you have that abnormal blood test. So we're really trying to figure out how do we educate the public, because we do know that it's already been made available at at the labs that we have around here. And it's a little bit dangerous to just jump to the conclusion with that test without any actual cognitive testing.
Yeah, that makes sense. Cause you think you have it, and all of a sudden you're questioning everything. I just have one question for each of you, and then we're going to open it up to the people out there that probably have lots of questions for you guys. Lena, can you tell me any recent developments in the Alzheimer's, or anything you find exciting or hopeful?
I'm really hopeful a lot of things, and since working here, it's been really exciting to see, you know, even 10 years ago, there wasn't really anything treatment-wise that could slow the progression. I know I mentioned there is no cure, but there was nothing really to slow the progression or really, you know, give families that time, you know, back, that precious time to have conversations to make sure, you know, wishes are being heard. And so, and I know, I mean, even talking with the folks here at the Neurology Center, they are administering one of the treatments that we have to slow the progression of the disease. And so much is happening in the research space that, if you couldn't already tell, goes way over my head. But you know, it's been so hopeful to see the advancements. I've been here with a chapter this year, be 4 years, and within those 4 years, we've seen 2 or 3 now treatments for Alzheimer's. So that makes me really hopeful for the future. I would love to see no one with this disease. If you have a connection or have, you know someone who has the disease or has since passed, you know how devastating it can be. I've heard, you know, some volunteers have shared, you know, their journey, and it's really, you know, you losing someone twice, right, with their memories and not being able to, you know, recall yourself, or, you know, being able to, you know, remember their family, and then eventually they do leave us, right? But, you know, I would love to see the day when we don't have that anymore, to give, you know, those memories and, you know, that precious time back to family. So all that to say, I'm really hopeful for, you know, all the advancements that are happening in the research space, and, you know, again, giving people that hope of a future, and that, like I said, a diagnosis doesn't limit anyone, and hopefully in the future it will never limit anyone.
So Andrew, when I went to your website when I was first getting to find out about you, your company, Neurology Center, has done lots of research in the past and current. Could you share some of those and what you're hopeful about?
We've been involved in clinical research for over 25 years, and what that really does for us is it gives us the clinicians actual experience with seeing what ends up happening with our patients that are in these clinical trials. Now, what ends up happening is we don't know who's on the treatment and who isn't on the treatment, but when we finally get the results of the studies, those are really encouraging. We were part of a group that helped to get the 2 most recent Alzheimer's disease treatments approved by the FDA. And now we're happy to be administering as treatments for our patients within the clinic. They are indicated for mild cognitive impairment, Alzheimer's type, and then also mild Alzheimer's disease. So it's a bit of one of those where you're a bit on a time crunch, that you want to be within that window for the treatment. There are side effects of it, and I'm really honest about what that does. To simplify it, they do a very good job of binding to those beta amyloid plaques in the brain, kind of untangling them and allowing your brain to clear it out. So that's what it showed in the clinical trials, is it did a very good job of that. Because we don't think that beta amyloid plaque accumulation is the only factor that ends up happening with developing Alzheimer's disease, this is not a cure. It's not a cure. It doesn't necessarily do anything for the tau protein issue, for example. And what we do know is that these beta amyloid accumulation has been happening for decades, 10, 20, maybe even 30 years before the onset of symptoms, and this cascade of events that ends up happening in Alzheimer's disease. So it's, in essence, a bit of the damage is already done. And really, how I try to explain it is that what the clinical trial showed us is the only way I would know if it's working for you individually is if I cloned you. And I gave one clone the medication, and I didn't give you the medication, and I test them after 18 months. And your clone did way better than you from a cognitive perspective and a functional perspective. So it's really difficult, even with these new revolutionary treatments, and this is the first disease-modifying treatment that we have for Alzheimer's. So it's truly, we didn't have it 2 years ago, and it's changed. I've been in neurology for 18 years, so it's changed how I'm practicing, especially when dealing with Alzheimer's disease. But it's almost as if you're looking at a train passing by from the side when you're trying to see results versus it's coming straight on at you. But over those 18 months, that slowing that they showed in cognitive decline, what I like to say about that is it's almost 2 years. So if we could reduce the cognitive decline for 2 years and allow for function for a longer period of time, that's time to plan. That's, okay, who are you going to move in with? Where are you going to live? That's time to save more money to accommodate for those things. But I think the biggest thing overall is that as we remove those beta amyloid plaques, there's space there now. So what can happen in those areas of space where the potential adverse effects is you get swelling of the brain, or you get bleeding that ends up occupying that space. It can be dangerous. We have this long checklist that we have. I have some of my colleagues here. We have this long checklist to try to make sure that the treatment is appropriate for the patient, appropriate for the family, and then also that we're going to keep them safe over that period of time. So these are exciting, and it's where I'm hopeful, because I feel that it's just the beginning of what we're able to do for treatment. But I want to highlight that the brain health things that we're talking about here now might even be more powerful than treatments we're going to have later, because it's preventing the damage that's already ongoing that we'd have to treat later. It's trying to prevent that overall. So that's we have hopeful things, but I don't want everyone relying on the science and innovation when we can do something like take a 30-minute walk every day to try to prevent it.
So do you have any research studies going on now that you might want someone here to participate in? And if so, we want to share what that is.
At our table over there, we have some pamphlets out for Profound Research, which is the research company that we perform studies with. Most of our neurologists are the primary investigators on these studies. We have several clinical trials going on right now for Alzheimer's disease specifically. A couple of them are medications, and another one is an injectable that we're hoping will show some benefit. And we've just finished up some studies that were diagnostics, where we're hoping to just do a little finger stick and test the blood there to see if we can identify serum biomarkers for certain dementias and conditions. So, and there's more kind of in the pipeline, but the clinical trials, I would say, what's the importance of that? Not only from a societal standpoint, right? Alzheimer's Association funds a lot of these research efforts, because what we learn now ends up helping the future. A lot of the clinical trials have an open label component to it, where you will be told you are actually getting the drug, and we're still studying. All of the treatment that surrounds it, all the imaging studies, all the diagnostics and follow-ups are included within the study as well, and there's also compensation within the studies too. So there's this societal thing that ends up happening on how can I help others in my community with being part of research, and it's always incumbent upon us to try to keep you as safe as we possibly can through those clinical trials as well. UCSD is doing a bunch of clinical trials. The ATRI Institute is another one that's here. So the advantage that we have here in San Diego is that we have these research facilities here. UCSD just published something this month where they think they found a new target for why people develop Alzheimer's disease when they don't have the abnormal genetics, for example. So yeah, we have a lot of resources here in San Diego of people doing great work in research. So I think if you're here, we take advantage of it.
Thank you. Before I open it up for questions and answers from all of you, I thought it more important to let them share, so I've cut our time a little short that we usually have Q&As. So when we open it up to questions and answers, please just limit it to one question, keep it very specific and relevant, and then if you have it coming to one person specifically, then tell us who you want to address that to. So who here, I'm gonna give this to Chris, and you can go around, and Karen's gonna go around as well. Karen, go ahead first. You know what, I'm gonna have you guys share a mic, and then we'll have.
I have a question about, can you hear me?
No, we can't. Can you wait a minute, please?
She asked me to talk.
Oh, okay.
I bet this one works.
You know, if we are couch potato and our muscles atrophy and lose volume, you mentioned we lose volume in our brains.
And if we exercise our muscles, the volume increases. Is there anything we can do about a brain that loses volume to get more volume? Can we do something, and if so, what?
So at least maintaining activity, what we believe is that you maintain the volume of the brain that you have. So that's first and foremost. Now, as we age, unfortunately, the brain cells die over time. So we can't necessarily say that there's going to be something specific that you can do to regain, volume and brain size. But everything that we talked about here with brain health and diet and stress management, exercise, etc., sleep, all of those things help to maintain more of the viability of these brain cells that we have, so that should we have a loss due to damage or a pathological condition, we have enough in neuronal reserve to compensate for that.
Is there any medication on the market, like Neurology, any pills that are beneficial for the brain?
So the supplements that I listed within the PowerPoint, which, there they are right there. So these were the supplements that were administered within that clinical trial that I was talking about with Dr. Ornish and his colleagues. Now, they didn't list the doses in there, and please you have to check with your primary care providers, your internists, before we do anything actionable with these supplements. So because they can sometimes interact with other medications that you're taking. And so this is what I chose to focus on. Now, supplements like Neurology, which isn't that the one where they did that great marketing campaign where they talked about getting it from a jellyfish? Yes, so that's a nice marketing piece that they did in that. Sorry, my wife's in marketing, so I understand these things. But in general, a lot of the supplements have these things, and they're just packaged differently. But it's important to talk with your primary care providers on the dosing of it and make sure that they review your medications before you initiate. These things alone, if you took these and then you did the couch potato thing, it's not going to help. So we don't want to use these supplements or pills to replace what we already know we should be doing, and so that it doesn't substitute or replace the exercise or the socialization, for example. It's a supplement to the things that we're doing for brain health.
Go ahead, Karen.
Are there any studies on the effects of cannabis on dementia, the relationship?
So the studies that I've seen go kind of two ways. The thought is that it can decrease neuroinflammation and oxidative stress. It does have some detrimental effects on sleep cycles. So, and we think the REM stage sleep might be affected by cannabis. On the other side of the things, where we're seeing an increase in hallucinations in our elderly population with the use of cannabis. And my emergency room colleagues are saying that they're seeing an increase of this as well, because the dosing is not properly understood. What we also have to understand is that while it's sort of a regulated industry, you don't really know where it's coming from. And so even the same packaged type of, like, what is it, gummies or chocolates, whatever they have, the dosing could be slightly different and create issues. So maybe perhaps the lower doses might help with the oxidative stress and the neuroinflammation, but in higher doses it might be causing detriment.
So we're just going to take one more question. And then please know that, okay, we'll take two since you both have a microphone. Go ahead first.
Okay, on exercising the brain, I don't know if this is answerable, but if I had a certain amount of time, is it going to be better for my brain to do the New York Times puzzles or read?
Great question. I think that for a time, you were Sudoku and crossword puzzles were starting to become a big thing, Wordle, but we did find that it was at a detriment to physical activity and socialization. So let's not let it replace going out to lunch with our buddies after golfing and say, well, I'm gonna go home because I gotta do my brain games for 3 hours and sit on the couch and eat a tub of ice cream while I'm doing it. So let's not, I think that it is important to do those things, but more so, does it do new learning, right? You're doing these types of games, and while initially you're learning a new game like Sudoku or Solitaire or whatever it is more beneficial to perhaps read or to go to activities where you're learning new things, and that'll create stronger neuronal connections rather than just the crossword puzzles and brain games. Yeah. And the other stressor is physical activity. That's the big thing that it cannot replace.
My question is how to improve sleep quality. I honestly follow all the recommendations that you guys have given and more to get good sleep. But my Fitbit records single-digit REM and deep sleep almost every night. My doctor thinks my Fitbit is wrong because I've been tested to rule out sleep apnea. And on that night when I was a sleep test and I hardly got any sleep at all, I had 25% REM. But it's been consistently very low, and I'm a little worried.
Can you keep the answer to 1 minute, because I want time for you to get over to your place before I want time.
Fitbits use a proprietary algorithm to calculate that, and we aren't sure that it's entirely accurate. So I would not just solely rely on that. The sleep study that you underwent, especially an attended sleep study, is much more accurate.
There's no way to increase REM specifically.
Exercise and diet.
Exercise and diet. So I'm gonna invite them to, the back, oh, there we go. Okay, so let's give them a hand, and please sit for just another minute while they go over and I have a couple of announcements.